welcome to the channel. I'm Dr. Jeffrey Galvin, and this is today's Wellness Wednesday. Today we're going to be talking about osteoporosis. Now, what is osteoporosis? What causes it? What can we do to reverse it? Will all be covered today. But first up is, what is osteoporosis? Well, osteoporosis essentially is the thinning and weakening of bones that occurs typically as we age, and in particular tends to occur in females after they hit menopause. Now, there's sort of gradations of this. There's osteopenia, which is partially reduced bone density, and then osteoporosis is reduced bone density that also predisposes you to fractures. And why do we worry about fractures? Well, you know, I'm sure all of us know somebody in our life that we've come in contact with who either had a relative or they themselves fell, broke their hip, and a year later they were dead. And we know that the mortality rate for folks who are in their 70s related to fractures from osteoporosis, in particular hip fractures, is somewhere between 20 and 40%, depending on the study that you look at. And it's a very high mortality, and part of it isn't really from the fracture, but it's the loss of independence and other things. So how do we prevent fractures that are going to occur from osteoporosis in our 70s and 80s? Well, we start worrying about them when we're younger, and really in our 30s, 40s, 50s, and 60s is when we really need to be paying attention to this. Now, what are the major risk factors for osteoporosis? Well, one being female, two, the loss of estrogen, so either menopause or surgical menopause. If you had a hysterectomy and they took both of the ovaries, then you're not producing any estrogen. In males, low testosterone can be a risk. Family history is certainly a risk. So if you have family members that have had osteoporosis and fractures related to it, you're at higher risk. The other thing is that people that have had multiple prior fractures seem to be at a little higher risk as well. Now, there are a number of risk factors for it, and besides those that we don't really have any control over, there are some modifiable risk factors as well. And those include excessive alcohol intake, smoking, lack of fitness. Drinking soft drinks has been linked to osteoporosis, certain medications, and in addition, endurance training. And so endurance training, like people who run a lot, actually are at higher risk for osteoporosis. And I'll talk a little bit about that later, that there's a difference between endurance training and strength training. And strength training enhances bone development and strengthening of bone, but running and rather endurance exercises oftentimes have the opposite effect. And so we actually sometimes are dealing with patients who have been very avidly physically fit, but are runners or distance athletes, and they're dealing with osteoporosis because of lack of strength training during their lives. Medications can play a big role, in particular chronic steroid use, especially glucocorticoids, which are used for a lot of chronic inflammatory processes. Anti-seizure medicines, a big one are PPIs, which are proton pump inhibitors, which are used for reflux. Nexium and Prilosec are examples of those medicines that lots and lots of people take. Coumadin, blood thinners like that, have been associated with osteoporosis. Lithium, folks that are having psychological problems that are on lithium have been shown to be higher risk, as well as a number of different diabetic medications as well. So when we're looking at managing osteoporosis and reversing it, sometimes we'll look at medications as well. How do we diagnose it? Well, the gold standard is to use a DEXA scan, and a DEXA scan is essentially a device that uses very low dose x-rays to measure density, in this case bone, and we can measure the exact density of bone and then compare it to other people that are your age, and we can find out, is your bone density good? Is it higher than normal? Is it lower than normal? The other test that we use here is what's called an N-Telopeptide test. That's a urine test that actually tells us whether you're actively adding bone or actively losing bone. So if we do a DEXA scan that shows osteopenia or osteoporosis and the N-Telopeptide shows you're losing bone, we know that that's going to get worse as time goes on. And then when we implement therapy, we can repeat that test, and if the N-Telopeptide shows then that you're gaining bone, we know that we're starting to reverse that osteoporosis. The typical medical treatment is a number of different meds. The most common one are called bisphosphonates. And those medicines have been shown to increase bone density. What they have not been able to show is that they have any effect on mortality related to these fractures as we get older. There are some medicines that you take orally, there are some that are injections, and they do seem to help, although they oftentimes have side effects, including increased risk for blood clots and other problems. And so as usual, as much as we'd like to be able to take a pill or a shot and fix things, that's usually not the best way. We've been treating osteoporosis here in our patients for over a decade, and we found that there's, a combination of things that really does a great job of not only stopping the progression of osteoporosis, but in many of our patients over the years, we've actually reversed it. And that is a combination of adding strength training, vitamin D, estrogen replacement, and sometimes thyroid and testosterone optimization, especially in men, but sometimes in women as well. Now, why do those things work? Well, we know that the loss of estrogen is very tightly associated with bone density losses. And so replacing estrogen is a bit of a no-brainer, and that's going to stop that loss. Why strength training, not running? Well, it turns out that if we axially stress bones, we kind of compress them this way, it causes a flux in the electrical charge in that bone that stimulates osteoclasts, which are the cells that build bone material, to get more active. And so if we add strength training, we're going to give the body a stimulus to produce more bone. Vitamin D plays an important role in this, and many people are low in vitamin D, so we really want to make sure that vitamin D levels are optimal. Sometimes people have thyroid issues. If we improve thyroid function, that will have a role in osteoporosis, and testosterone as well can sometimes have a role. Men are at less risk of osteoporosis than women, although they still develop it. And women sometimes have low testosterone just like men do. They just need far less. And so all those things are things that we implement. We do baseline DEXAs, and then we do that N-Telopeptide test to actually see if what we're doing is having an effect. And we, over the years, have reversed plenty of people that have had osteoporosis and osteopenia back to normal bone density. I think that's kind of the overview of osteoporosis. Hopefully that answered some questions. If you want more information from us, we'll put some information up here above me, I guess. You can contact us through our website. The things that you can implement today without any input from anybody else is add some strength training to your regimen, squats, even body weight exercises, dumbbells, barbells, whatever, but you want to be doing strength training. You want to make sure that you're getting good nutrition, in particular getting good amounts of vitamin D. The other piece of that, probably need a physician to work with you, but those are basic things that you can implement right today without any cost or effort, or well, a little bit of effort obviously, but not a huge amount of effort on your part. I'm Dr. Jeffrey Galvin. This has been Wellness Wednesday covering osteoporosis. Please message us if you have any questions. Put comments below if you have topics you'd like me to cover. If you put it in the comments section, I will add it to my list. I'm slowly going to go through all these different topics as people want me to cover them. Have a great day.